Welcome, Dr. Shetty, to Editor Speak. So, you are a doctor. At times, you also need treatment. Similarly, other doctors also must be coming to you for consultation. So, then how are doctor patients different from a legal perspective?
Me being a doctor, I am aware that we are bad patients. We love to give advice, but we rarely ever follow our own advice. There are times when a patient who is a doctor comes to us as a patient, we tend to presume that he is aware and we don't feel the need to explain the details of what we are planning to do with them. So my advice will always be that treat any patient despite him being a medical professional or a doctor as another patient, or you would have treated any other patient.
Sir, a patient is a patient. What do you mean as any other patient?
When we have a doctor as a patient, we tend to presume that he will be aware of so many nuances of what is going to be done or what the consequence of the treatment will be. Hence, we tend to overlook to explain the details of the treatment as we would have done with some other patient. More than that, we tend to not document what we have explained to the patient. And all these things may land a doctor in trouble. This is best illustrated in a judgment, recent judgment from the National Consumer Commission. A patient with multiple comorbidities, known complaints of diabetes, past history of angioplasty on blood thinners, consulted a cardiologist. The cardiologist advised angiography for knowing the status of the unstented coronary. Angiography was performed, 70% block was detected. Elective angioplasty was advised. The angioplasty was performed the same day. During the intervention, the patient had pulmonary edema. Patient was put on a ventilator as the diuretics failed. The BP came down, an intra-aortic balloon pump was inserted, small doses of heparin was given. The patient had a brain hemorrhage. The patient was transferred to another hospital under a neurosurgeon. The bleed was drained. After many months, the patient got discharged and a left-sided paralysis. The relatives of the patient made many allegations against the cardiologist. But one specific defense of the cardiologist stood out for me. The cardiologist in defense stated that the patient and the patient's daughter, being doctor, knew or aware of the risk and benefits of the intervention planned. The court rejected this defense outright. The court stated the cardiologist overlooked the bad condition of the lung and went ahead and did an angioplasty which was elective. The court went on to add that the cardiologist was trying to shirk his responsibility by stating that being doctors, the patient and the patient's daughters were aware of the risks of the intervention plan. Hence, the court held the cardiologist negligent.
Sir, so what would be your advice to doctors while treating patients who are doctors?
My advice would be very simple. Be very clear, be very detailed when counseling the patient for an intervention or what treatment you are planning to do. Never fear to or never forget to document whatever you have told the patient. And after all this, you continue and do whatever you plan to do with the patient. But remember, treat them as any other patient and do not give any special privileges. Do not bypass protocols.
Sir, hope our doctors treat their doctor patients as any other patient and not as colleagues.